Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, if the patient is methods for repairing the damaged ureter. So once the ureter is damaged, we have three different methods for repairing the damaged ureter. One, if there is no loss in the length. If there is no loss in the length, then you can directly anastomose it by end-to-end anastomosis. You can just, without tension, you should do an end-to-end anastomosis of the two ends of ureter is recommended. Second, if there is very little loss of length, if there is very little loss of length, then we can mobilize the kidney and then make a psoas hitch of the bladder. In psoas hitch of the bladder, you bring the bladder upwards and you combine it with the psoas muscle, which is called as psoas hitch of the bladder. It is recommended. Or we can do a Bovary flap operation. In Bovary flap operation, the bladder is taken and this part of bladder is refashioned into the ureter and it is anastomosed with the ureter to maintain the continuity of the ureter and the bladder for the passage of the urine. Second, if there is marked loss of the length, if there is marked loss of the length, we cannot do either Boyer's flap or psoas hitch procedure. Now, in this case, you can transpose one part of the ureter which is injured to the other part of the opposite part of the ureter, so that the urine which is formed by this kidney can be drained and this kidney is saved. Second, we can also put a bowel loop can be put between the ureter and the bladder so that the continuity can be maintained. But if all of these does not work, at the end we can do nephrectomy where we can remove the kidney also.
thank you and thank you for watching.